4 patients, 1 nurse. And before you even walk in the room, you're asking yourself one question: who is trending in the wrong direction? The first patient is post-op, day 1 from a knee replacement surgery. Blood pressure 118/72, heart rate 94, pain level an 8 out of 10, and asking for pain meds. Your second patient has COPD and is having an exacerbation, on 2 liters of nasal cannula this morning, but is now already up to 4 liters just to keep the SATs above 90. Patient 3 has new confusion after lunch, but vital signs are currently stable. And patient 4 is febrile at 101.8 Fahrenheit with a heart rate of 112, but they say they feel fine. You can only see one patient first, but which one will you prioritize? Well, by the end of this video, you will be so confident with this decision-making process, you'll be ready to teach it to your friends. Students often struggle with these decisions because they don't know, should they do ABCs first, Maslow's first, and it gets really confusing. But the real clues are often hiding behind all the noise. This is where judgment, not memorization, matters. Advanced prioritization is about recognizing patterns of decline, instability, time-sensitive harm potential, even when exam questions or real life tries to distract you. Before we make any plans, we need to pause and think. Which patient is showing signs of change? Which one might be declining fastest? Prioritize the patient who is changing, not the one that's most loud. This one principle will carry you through the case, the exam question, or the real-life scenario. Let's apply our first layer of the 4 Ps, or pause, to our 4 patients. So what is the stem of the question really telling me? Let's look for the trajectory. So first we have patient number 2 that increased from 2 to 4 liters of oxygen. That's a change in support. We also want to look for new symptoms. Patient 3 has new confusion. That is a neurologic change. We also want to look for compensation. Patient number 4 has fever and tachycardia that suggest early sepsis, even if they feel fine. So as we move into the prioritize phase, we have 3 patients that are having some type of a change. But real problems, current problems, override potential problems. The patient with the most concerning stability change is patient number 2, whose oxygen needs are changing right now. Tessa is joining us again today, and she's prepared a wonderful visual aid that helps the new nurse figure out how to scan all 4 patients and how to zone in on the changes that are happening or not happening with each of these 4 patients. So you can see we have the patient with oxygen changes, we have the patient with pain, we have the patient with neurologic changes, and we have the patient with a new fever. Let's add a little nuance because prioritization is never simple, right? So patient number 1 is reporting severe pain, 8 out of 10. So that is going to feel like a priority to you. But actually, this is an expected finding, and the patient is actually fairly stable. They're not at risk to have any major life-threatening decline right now. All right, our next little nuance. We have patient number 3 with new neurologic changes. So that is certainly concerning. However, their vital signs are stable, so they're not in imminent danger, but we definitely want to check them out as soon as possible. Our next conflicting cue is patient number 4, who currently says they feel fine, but we have abnormal vital signs starting. This could be signs of sepsis coming. So although they're not critical at the moment, we definitely don't want to let them go too long. All right, here is where the hidden priority shift can happen. If patient number 2 suddenly starts to have another oxygen deterioration, then they bump up as the priority. But if patient number 4 with pending sepsis suddenly sees a blood pressure drop, then we're going to see them bump up higher in priority. This is where our 4P framework helps us prevent cognitive errors. So first we pause to identify the real risk. We prioritize to see who is showing the biggest signs of decline or change. We plan to keep them safe, and then we prove whether or not our interventions worked. Back to patient number 2 with the oxygenation problems. Our plan would be to do a thorough assessment. What is their work of breathing? What do their lungs sound like? And we would plan to increase the oxygen as needed. And then we would prove to see if our intervention of adding more oxygen worked or didn't have the effect we were hoping for. Tessa is back with a second visual aid for us, and this one I like to call the mental checklist. It shows advanced priority clues that we should all be looking for, and this just shows how smart we're thinking. What kind of decline pattern are we seeing? Is there hidden instability? Is there a time-sensitive window we need to be worried about? And what types of action are going to emphasize safety first? Thanks, Tessa. You're doing an excellent job with your visual aids. I think they're helping our students and all of us nurses learn so much more about how to stay on track with our thinking. This is how confident nurses think. You're not reacting to noise. You're reading the body's signals. You're not memorizing rules. You're recognizing patterns. And you're not guessing. You're using a framework that protects your patients. See, each time you use the 4Ps framework, you're building yourself into a safe, clinically grounded, thoughtful nurse. If you want to go deeper into prioritization, check out the playlist on my channel. And if you enjoyed today's content, be sure to subscribe and hit the notification button so that you don't miss another Deep Dive Sunday with Nurse Terry and Tessa. Have a great week.